Hey everyone, it's Dr. Jason West, and we're Thursday night live, 5 o'clock Mountain Time. We're always talking about different healthcare conditions. Last week we were talking about prep for arthritis and what to do with fatigue and everything, and now we're going to talk about fibromyalgia. And so if you are suffering from this, or you know someone suffering from this, like here's some secrets. This is a presentation that I did about 2 years ago, and we updated it for the live cast that we have. But it's so frustrating to hear how long people have been suffering from fibromyalgia, especially when I tell you some of the hacks or the tips or the things that you can do that will really, really help this. Because fibromyalgia is no fun. It really means that you have muscle pain that hurts all over. And if you want more information, would you like and share it and give it to other people that have this? Because so many of the things that you can do for fibromyalgia don't cost anything. And it's frustrating when people just go into their medical professional and they'll just say, here, well, you know what? The reason why you have fibromyalgia is because you're depressed. Let's give you a happy pill, when there's an underlying condition for the muscle fibers that are hurting all over. So if you'd like and share, it'd be great to share information. And the other thing is we have a wonderful report on fibromyalgia, and all you have to do to get that, we'll pick it up for you, is just do hashtag FMS, which stands for fibromyalgia syndrome. FMS hashtag is what we want to do. And the other thing that we're having a lot of fun with is we've had people come from all over the world to our office in Idaho. Just today we had some people from Texas, but we've had Abu Dhabi, we've had Russia, we've had England, we've had all 50 states. And I would love it if you give us a shout out of where you're from, which state are you, where you at, and of course always shout out to our regulars of Arnold, of Cupcake Paper, of Thressa, of Sarah, anyway, and of course my friend Mr. Harmon in Star Valley and his wife Julie. This presentation will help a lot for you guys. Now, that being said, if you want the report, hashtag fibromyalgia. And here's what I tell people when they tell me this diagnosis. Number one, do you believe this diagnosis? Because the most important thing that you do when we start working with people is to recognize there's a person in there. It's not your diagnosis. And fibromyalgia is not easy to take care of all the time. Sometimes it's easy and sometimes it's difficult. But really, if you put the body in balance and you put in harmony, good things happen. So if you're just joining the program, we're talking about the secrets to fibromyalgia, what you can do. We're also offering a free report. It's just hashtag FMS. So let's talk about it. Like, I see this a lot in fibromyalgia. People they just hurt. And maybe the best way to describe it is this. You know, if I go to the gym, or when I go to the gym and I max out on weights and I use up the oxygen that's in my muscles, oxygen is not the final electron acceptor in the electron transport chain, and so there's no byproducts of carbon dioxide and water. The byproducts are lactic acid and pyruvate. The lactic acid builds up in your system, which, by the way, I just kind of stole some stuff from later on in the program, because if oxygen is abundance in your body, it is so amazing what it does for fibromyalgia. And we're going to talk about a couple different ways to get that into your system. But until you repay the oxygen debt, you are going to have lactic acid, and it is going to hurt. Now, the difference between me going to the gym and getting lactic acid in my muscles from an extensive workout, that's what fibromyalgia people feel all the time. And that's a tough place to live. And because they don't feel very well, what happens is it really works on their emotions, and they have a tendency to be melancholy and depressed and have cyclic mood disorders or rebound anxiety and stuff like that. Because if your body's not healthy, then it's hard for your emotions to be healthy, and it starts that whole vicious cycle. So I see a lot of this, of people literally curled up on their couches, and I see so much fatigue. And I love this diagram. Everybody thinks initially, you know what, it's just a heart diagram, and what does heart have to do with fibromyalgia? Well, it's this. The heart is the most important muscle in the body. It's the first muscle to show stress and nutritional deficiency. And when your heart's not tuned up, what happens is you have an impending sense of doom. Like, people are like, I don't know what's going to happen. I can't put my fingers on it, and I don't feel good. And what's happening most of the time is people are deficient in one of the B vitamins. Now, I want to talk about this because it's really important to understand there's 30 B vitamins We always talk about B1, B2, B3, B5, B6, folic acid, B12, but the anti-paralytic vitamin is so important in conditions for fibromyalgia. It's vitamin B number 4. And what it does is it has an amazing effect in regulating the heart. It's in a proteomorphogen pathway, or what that means is there's a specific building block that you can get inside of your body. It's talked about in our fibromyalgia report. And what happens is when you give people that vitamin, it starts to tune up your heart. It acts, in my experience, it acts like a nutritional pacemaker. All of a sudden, the impending sense of doom that's so often caused with people in fibromyalgia, it'll dissipate and it'll go away. So, by the way, there's an easy way to evaluate if this is a factor in people that have fibromyalgia is to do something called Ragland's test. And so Ragland's test, obviously named after Dr. Ragland, figured this out. So, got to look in the camera. If you take your blood pressure lying down, ideally it should be 120/80 with a pulse rate of 60 to 90. If you stand up and take the blood pressure again, a couple things are supposed to happen. Number one, your adrenal glands are supposed to tell your heart to beat harder. So your blood pressure should go up when you go from a lying position to a standing position. What should happen is it should go up 6 to 10 beats on the systolic and the diastolic. And then what should happen to your pulse rate is it should stay the same. So translation, your heart should beat harder, not faster. This is so important. If you've been diagnosed with fibromyalgia, or if you think that you have fibromyalgia, like, do this test. It's so simple. All you need is a home blood pressure cuff. Take your blood pressure lying down, stand, and your pulse rate, and then stand up. It should be higher standing up than lying down, and the pulse rate should be the same. Frequently, it's not. Now, it's a sign of some cardiac fatigue and adrenal dysfunction and some other things. It's a good starting pot of where to go. And then guess what? Vitamin B number 4 helps to put some rhythm in your heart. In the clinical experience, it's one of the things that my grandpa taught my dad and my dad taught me, and it's been really helpful in fibromyalgia cases. Now, that being said, the next thing to recognize is that fibromyalgia is a complex, multifactorial system. And what does that mean? I have found that with fibromyalgia, most of it is contributed or caused by a mineral imbalance, basically magnesium to calcium ratio, magnesium to potassium, and magnesium to phosphorus is where I start. There's also a hormone component, and almost always in complex fibromyalgia, there's an infection component. Now, what that means is, according to the British Journal of Medical Practitioners, chronic bacterial and viral infections. So we start talking about staph and strep and Epstein-Barr and human herpes simplex 1, the cold sore virus, and the rotavirus and the rhinovirus and cytomegalovirus, parvovirus. All of these viruses, basically what happens is it causes your body to have neurodegenerative neurobehavior, psychiatric, autoimmune, and fatiguing illness. So a lot of doctors are saying, hey, fibromyalgia is autoimmune. I don't really believe that. What's happening is it's a dysfunctional immune system when there's not the correct protein and building blocks and vitamins and minerals inside of the muscles. There's not enough oxygen in the body. And so as those cells are trying to create energy and they're taking glucose and they're going down through the electron transport chain, if there's no oxygen there, it's lactic acid. And you hurt. And then when you hurt, it's hard for your emotions. So it's a complex issue. And again, just reviewing some terminology. What does it mean? So if you look up here, I guess up here, myo means muscles, algia means pain, ia means state or condition. So it's a state of pain, and basically the muscle fibers hurt all over. And it affects about 6 million a year, 4 million, obviously doing math, 66% are women, and occurs most of the time in your 40s. Not all the time, but a lot of the people that are affected with fibromyalgia are like, hey, I was great. I got around that 40 mark, and guess what? The wheels fell off. And when the wheels fell off, what happens is people, they try to compensate. And the compensation comes in the form of a crutch. And what does that mean? So you're looking for sugar or caffeine, or nicotine, or drug therapy, or alcohol, or chocolate, or stress, or drama, because what that does to your body, gives it a little bit of upper, the neurotransmitters fire, you get a boost of energy. It's like throwing gasoline on the fire. You get a bunch of energy, and then it goes down. So one of the things that frequently you see in fibromyalgia, 90% of the time, it's 40 plus, and the condition or the symptoms between males and females are pretty much the same. And it's the third leading cause of a rheumatologic disorder, which means it gets into basically the bones, the joints, and the muscles. So some of the symptoms of fibromyalgia, this is how people feel. You know, you get widespread pain. Pain sucks energy out of your body. There's 17 tender points, for the official diagnosis, and basically you want to put just a little bit of pressure on it, and so that means just enough so that your fingernail blanches. And there's a bunch of different points. You'll see it in a map in just a minute. Most people that have fibromyalgia are not sleeping that well. They get frequent urinary tract infections, a racing heart because their heart's tired, their adrenal glands are exhausted, they can't produce energy, their stomachs are a mess, and a lot of people are like, look, can you just when we do the workup, just turn the light off, or they're well sunglasses because there's a light sensitivity. And so here's some of the points that you see. These tender points appear in the diagram. And Caden, if you can back us out just a little bit so we can see the diagram a little bit better. And let's shift him over. Here we go. So I got to look over here. So a lot of stuff in the back, along the pelvic crest, by the collarbone, up in the upper trapezius, in the rhomboids muscles, in the upper trap, in the thighs. Anyway, there's 17 points that you can go to for a diagnosis, and 75% of people experience sleep disorders where they can't get to sleep or they can't stay asleep. And this is aggravated by extremes and humidity. And so if you're just joining us, we're talking about fibromyalgia, of how there's some neat things that you can do for that. Vitamin B number 4 is one of them. We're going to talk about where you get it in just a minute. And also we're going to talk about what things that most people are not aware of, which is the mineral imbalances. And there's a report available, hashtag fibromyalgia, FMS. So one of the things that's really important is to make sure you're doing a thorough workup. It's shocking to me how many people come into the clinical system, and what happens is I'm like, well, how do you feel? And they're like, well, I hurt all over, I'm depressed, I'm not eating very good, I can't sleep. All of the classic signs. And I'll say, well, what are you diagnosed? Well, they told me I have depression, or they told me I have fibromyalgia, and they give me Cymbalta, or they give me Lyrica, or they give me an antidepressant, and I'm like, does it help? And then most of the time they're like, no, it doesn't help, or they wouldn't be in the office. It's important to get a proper exam where you're checking the joints and the muscles and the range of motion, and I think it's so important to get a blood chemistry assessment. I see so many people that come into the office where they get the diagnosis, they get a happy pill prescription, and then what happens is they don't have any blood tests. Obviously, you can't diagnose fibromyalgia off of blood tests, but the way to put people back together, and this is the book that we wrote called Hidden Secrets to Curing Your Chronic Disease, is you got to balance everything. And so many times in the blood test, you'll see a low calcium, which is typically under 9.0, ideal is 9.8. You'll see a low protein level, typically below 6.4, which means their body is going and taking protein from the muscles and from the joints. And then frequently you'll see a low white blood cell count, which ideal white blood cell count should be 6. And then what happens is, this is the key that you should look at on your test, is your lymphocyte count. Because so many times, it should be 30, so many times people will be at 39 and 44, they'll be above 50. And what's happening is the immune system, the white blood cell count's low, the body's not responding. And then there's a viral component, typically Epstein-Barr and simplex 1, parvovirus, etc. And it's like your immune system is guard dogs at your house. They're supposed to be chasing off the bad guys, and they don't respond. And so it's important to do a thorough evaluation with blood tests so that you can see. And then what really causes fibromyalgia is, it's the 3 T's. So the 3 T's, man, it's so hard for me. Okay, trauma, thoughts, and toxins. What trauma means is physical stress. And so many times injury precipitates fibromyalgia. And then because you don't feel good, it starts a mental stress pathway, the thoughts, and then the toxins. So many people are just bound up with toxins. It's from the foods that they're eating, too much plastic in their foods, too many chemicals and pesticides and herbicides. And people say, wait a minute, I'm not eating that. And my response is, well, are you eating food with preservatives in it? Yes, but I would never eat an insecticide. Well, what a food preservative is it's something that prevents bugs and bacteria from eating the food. Guess what? It's an insecticide. And then the pesticides, so many times we have pesticide residues in foods and it's toxic. So traumas, thoughts, and toxins. So one of the biggest things, auto accidents, sports injuries, slips and falls, poor posture, repetitive stress, poor ergonomics and stuff are really, really damaging to the muscle system. And so trauma precedes fibromyalgia. And then the other things, and we talk so much about stress. Remember, stress is not a disease. It just makes every disease worse. And so many times what happens is people have stress from marital problems, financial problems, depression, a pet dying, a family member, a friend dying, loneliness, boredom. All of those things, basically, if you don't have a good outlet for those, it's going to exacerbate health conditions, but particularly fibromyalgia. So people say, well, Dr. West, what should I do? And the response to that is, look, I don't know what your stress outlet is. For some people, it's gardening, it's taking a walk, it's meditation, it's prayer, it's deep breathing, it's playing a musical instrument, it's listening to a musical instrument. Like, I don't know what it is for you, but we need to find out what that is and then make sure that you have an outlet of it every single day. Like, we need to put it on the schedule and say, look, from 8:15 to 8:30 every day, Becky is going to have this stress outlet, which is she's going to take a walk. Or Caden's going to have this stress outlet where he's going to exercise. Or Jason's going to go ride dirt bikes, which is my favorite way to get rid of stress. And so with that being said, make sure that you have a good stress outlet. And then toxins. And one of the biggest toxins we have is, unfortunately, one of the best tasting and addicted, and that is sugar, high fructose corn syrup, tobacco, drugs, toxic buildups, and vitamin deficiencies. And so many people have vitamin deficiencies, even though most of us live in a first world country and we think, how can we be malnourished or how can we have vitamin deficiencies? And that's because we're not eating stuff close to the ground. And close to the ground means, like, you know, it's easy to go get a strawberry off of the plant. It's easy to get an apple, and it's close to the ground. What happens is so many of the people are eating fast foods, are eating licorice, are eating stuff that comes out of a box, a wrapper, and a can, and it's just dunked in chemicals. And by the way, when you get chemicals into your system, you're either using it for energy, you're using it for building blocks, or you get rid of it. And so many times people are stove up on their phase 1 and phase 2 detox pathways, and so guess what? They store it. And where do they store it? They store it in fat. And where's the fat located? Well, it's located in the fascia, it's located in your stomach, it's located in your brains and your nerves. So one of the best things to do for people that don't feel good is heat deprivation therapy, which is sauna treatments, it's infrared treatments. For those people that can move and exercise, getting hot and sweating is so important for your body and your health. So a holistic approach to fibromyalgia ideally should include some movement, which is exercise, low impact, such as swimming and walking are really good. But I also tell people, look, if you like to garden, if this is an outlet for you, gardening is a really good exercise. If you can't do the typical walking or anything like stationary bike, or at the very best, like, just try to move a little bit more. And a lot of patients with fibromyalgia, like, this is so hard for them because they say, look, if I felt better, I could move. And if I move, I would feel better. And so what I say is, like, just try to move a little bit more. The other thing is, and I am guilty of this, like, I am a reformed soda pop addict. When I was going to school in the 90s, I was working from 2 a.m. to 8 a.m. I would go to school all day long. I wanted to have a normal social life. So what did I exist on? This stuff right here. And I really like this. I drank, I'm embarrassed to say, for a couple of years, it was about a 6-pack a day to function. And I really liked it, especially like with certain foods. Like, I love hot Mexican food and cold Pepsi. And I know it's not good for you of having that acid in your system, but man, it is devastating for people that have fibromyalgia. And if you think about just the physiology of this, it is an acid. So if your muscles are hurting and you decide, I'm going to put acid in my system, and so many times people are like, I'm not drinking acid, I'm just having soda pop. And my response is, hey, guess what? You know what gives soda pop its fizz? It's carbonic acid. We're putting carbon dioxide in it, and we're making it fizzle. Then we put in an artificial sweetener, and we put in a bunch of sugar or high fructose corn syrup, And even worse is doing the artificial sweeteners, which is high-dose amino acids that at high levels the body perceives as sweet, and it doesn't break down correctly, and I really think it leads to toxic fat syndrome. And toxic fat syndrome is what happens when you hit chemicals in the adipose tissue of your body, around your nerves, in the fascia, and you hurt. And that's one of the components of the artificial sweeteners. Like, if you're to sin and go to the dark side and drink soda, like, I really think you should drink like the normal stuff versus the unleaded. And neither one of them is good for you. Also, really important approach is food. Organic high foods, uncooked raw form. If you cook, steam the vegetables. But the healthier alive your food is, the healthier and alive you are. And so we want to eliminate stuff that's been pre-processed, prefabricated, pre-digested. You just throw it into the microwave. It's not healthy. Like, you got to go back to a holistic approach. Okay, so some supplements that are really important. And I tell people, look, my favorite supplement is vitamin C because it donates electrons to the body. Magnesium, malic acid, thiamine, vitamin B6 is one of my favorite natural anti-inflammatories. Manganese, it's different from magnesium, basically helps ligaments to be healthy, and ligaments can be depleted, manganese can be depleted in conditions like infections. And then essential fatty acids, which is things like coconut oil, fish oil, flaxseed oil, evening primrose oil. Basically, it's like the Tin Man on the Wizard of Oz. He didn't have any oil, he was stiff, he didn't move very well, and then what happens is you put oil in the system, things start to work better. That's what fish oil does. And something that I don't have listed, so this is a really nice perk for you, is sugarcane extract called beta-col. And what beta-col does is it's full of something called Wilson factor. Wilson factor was discovered by Dr. Wilson, I believe, up at the Oregon State University of Health Sciences. And what found is that Wilson factor helps detoxify guanidine, which is a toxic chemical that gets inside of the joints, makes the joints stiff. It builds up, and Wilson factor, also known as anti-stiffness factor, gets rid of it. So we take sugar cane, we take the poison out, we feed it to people, we throw away the good stuff, which is a Wilson factor. It's a really neat thing for fibromyalgia. Now, there's a done-for-you program if for those that are trying to figure out where to get it, and just some quick guidelines. Essential fatty acids, 4,000 to 6,000 milligrams with the proteolytic enzyme, which means something like papaya or bromelain, is a really good place to start. Having a comprehensive mineral formula that you feel different when you take is so important, because so many times people are like, look, I take a multivitamin, and I'm like, well, does it affect you? I don't think so. Well, guess what? It's probably a good idea to throw away the pills and eat the bottle. So that's why, right? If you don't notice that you're on something, I don't think it's probably that great for you. I like something called the Joint Freedom. It has the collagen peptides in it. And remember, fibromyalgia is a rheumatologic disorder, which means your muscles, your tendons, your ligaments, your joints don't work very well. I really like this. And then the Joint Revive. Now, you can get this from personalizedotc.com. If you'd like it done for your program. It's in the fibromyalgia report, and to get the report, it's #FMS. I'm really excited to share that with people. We have such a cool arthritis program that's coming, where we have a free webinar where we spend literally, these are the foods you should eat, the foods that you should avoid. This is what you can do at home. These are the treatments that you haven't heard about. These are the advanced therapies that are available in certain offices across the country. That people are beating fibromyalgia all the time. We're beating osteoarthritis and psoriatic arthritis and rheumatoid arthritis, and people are just winning. And it's exciting to do that. So if you want information about the supplements, #FMS. If you don't, great. Essential fatty acids, 4,000 to 6,000 milligrams. Vitamin D, I think 5,000 to 10,000 international units is a good place to start. And papaya, bromelain, and stuff like that are really good enzymes that chew up inflammation. The other part of this, the Joint Revive. So what's cool about this product is something called cetyl myristoyl. We abbreviate it as CMO. And CMO is one of those hidden things I wish more people knew about, because what it does is it just flat out whops up on arthritis. It's so good for your muscle function. The collagen that's in here, the N-acetylcysteine, which basically is a garbage truck to get stuff out. Resveratrol, which is really good for red blood cell health and oxygenating for the body, and manganese again to make strong ligaments. So many times people with fibromyalgia have depleted manganese, and so their muscles hurt. So manganese, manganese, manganese for people that are having ligamentous instability. And I really like treatments for fibromyalgia for things like adjustments, massage therapy, physical therapy, stretching, movement. You want to keep everything moving freely. And then some advanced procedures. And so this is the stuff I really like. IV nutrition therapy where you can skip the stomach. It's a modified Myers cocktail, which means vitamin C, B5, B6, B complex, magnesium, zinc, potassium. You skip the stomach and you can start helping the muscles from the inside out. The other thing that's really effective for muscles that just hurt is to do trigger point therapy, where you take vitamin B12, you can take 5% dextrose, which is a real mild sugar solution and nourishes the nerves, and you can skip the stomach and the vascular system and inject the muscles, and then oxidative medicine, things that get oxygen into your body. So how do you take care of this, or how do you get information about this? It's hashtag FMS Fibromyalgia Report. I love this little graphic right here because in the vitamin infusion therapy, what happens is we're literally taking kiwi, which has vitamin C, and oranges, and grapes, and apples, and we basically put it into an IV solution, and it's just, you see incredible patient outcomes happening literally on a daily basis. We have the vitamin injection therapy where you're literally taking vitamin C and you're putting electrons into the body, and then ozone therapy. And this is one of the reasons why I created a link for people so that they can get home ozone therapy. And what that means is there's a specific way to get oxygen, doing rectal insufflation, doing ozone water, doing ear insufflation. And Dr. Vilio Bocci, a medical doctor, one of the modern medical heroes, wrote a book called Ozone, the New Medical Drug, of all the things that it can take care of. And it's literally fantastic. And one of the reasons why you're not seeing this in basically big pharma traditional medical pathways is because you can't patent oxygen, you can't patent ozone. It's a wonderful delivery system of how to reverse muscle pains in fibromyalgia. So I've covered a lot of materials. It's so fun to take people that are out of hope and out of time and out of options and give them hope. I'm excited to share with you a couple testimonials. It's not just me saying it. One of my favorite ones is my rancher that feels great. Martha's going to talk to you about fibromyalgia, and then we're also going to show you Darlene. Now, what happened with Darlene is she's been told she had fibromyalgia. None of the medical treatments was helping her. We found Lyme disease in her system. Lyme disease is the great imitator, so I'm excited to share that story. But Caden, let's cue up Martha and show people. Look, it's not me saying it. We have hundreds of video testimonials on our website, dailydosevitaminh.com. But here's Martha's story. Check it out.
This started about the beginning of 2011. I just was getting sick a lot. I had a lot of fatigue. I wasn't really feeling like myself. And I have 3 small kids that I was running around after, but I couldn't really keep up with them. And I started expressing some concerns to my husband, I think there's something wrong. And he's, oh, you're okay, maybe you need to rest a little more, drink some more water. And it just kept getting worse and worse and worse. And then about August of 2011, I threw out my neck and my back. And it all went screaming downhill after that. I went and saw a chiropractor who said that I had torticollis, and he treated me for that. And then I had some adjustment problems that went awry. So I left that, and I was getting discouraged again because the pain in the neck and my back was overwhelming. And so then I went and saw a physical therapist who told me, I think there's something more going on here than, you don't have torticollis. She said, I think you actually have thoracic outlet syndrome, but there's something else going on. And so she was really the big push for me to go and see someone. And so she said, why don't you go see an endocrinologist? So I went and saw an endocrinologist, great guy, and he told me, there is something going on with you. You have all of these problems, and I listed off a name of just symptoms that I had, and then he read them back to me, and I just started crying because it sounded like I was dead. I felt dead. I felt very robbed of my life. And so he ran every blood test known, physical. I got an MRI done, and what came back is all of my different levels for either checking liver or the heart or pancreas. He said, well, everything's in the okay zone. And he said, but your MRI did come back and you did have one white lesion above your right eye. And he said, my wife actually has MS, and you remind me a lot of her. She had a very active life, and then the symptoms came on quite strongly, and now has a very different life right now. And so he was a really great guy. He just told me, treat your symptoms. He offered to put me on different medications, but I wasn't quite ready to go down that route. And so when I did find out about the clinic, about the West Clinic, I called back my endocrinologist and told him everything that I had heard and everything that I'd read, and he told me to go for it. He's like, you go there and find out what you can, how you're feeling, and then he said, would you call me back and tell me how it's going, because I've got a whole waiting room full of women that are just like you and I don't know how to help them. So when I got the okay from him, because I really, really admire him as a doctor, brilliant doctor, and so I took the leap forward. And after I kind of done my research with the clinic and looked up some other things, and my husband was totally on board. So then I came here, and I noticed a big difference right away.
And how many treatments have you
I think I'm on treatment number 10.
Okay.
I think this is my, actually today was, I think, my 10th IV.
Yeah, and will you in time get another MRI to see if the lesion is shrinking?
I was supposed to get one in April.
Yeah.
And I didn't. I need to. I think eventually I will. I'm just feeling too good with what I'm doing right now. But I would be interested to see if it went away or just kind of maybe shrunk or completely stopped everything altogether. My hair stopped falling out. I don't have any fogginess in my right eye anymore. I don't have as many flare-ups. My flare-ups come all the way up my back, into the back of my neck, and my flare-ups feel like a very intense muscle cramp, but then light that on fire. It's so intense that if whatever I'm doing, I just have to stop and sometimes just squeeze my head because the pain is so bad. So I do have those occasionally, but they're nowhere as near as intense as they were before. Sometimes I just feel like my neck is tight, so I'll just move my neck around, and then I will say out loud, oh my gosh, I think I just had a flare-up. Wow, well I can handle that. That was nothing. And the extreme joint pain and the stiffness is now gone. I've started exercising again. Yay! And the swelling, I used to wake up with numb arms and very swollen arms, and that has gone away. So,
Okay.
I'm getting my life back,
You are.
one IV at a time.
Okay, you guys, so I have a couple questions that I have to go over, and we're getting ready to show another testimonial in just a second. I'm excited to share with you of someone that was like, hey, I'm exhausted, I can't function, I can't work, and then we put together a program to put building blocks and stuff into her system. So my friend Theresa says, should you avoid coffee? it's pretty acidic. And my response, yes, I would agree with you. If you are feeling run down and not feeling very well, what the goal is to not put anything in your system that's going to gum things up. So I really like to tell people, like, water is so helpful in so many different conditions. I avoid orange juice. I think that's really acidic. I don't do apple juice. When you're in a sick state, I would avoid coffee, or at least limit it as much as possible. A follow-up question like that to my friend Misty. Well, first of all, thanks for joining in. The second one, she says, Dr. J, is Dr. Pepper as bad as Pepsi? Nope, Pepsi is the worst. Dr. Pepper is totally fine. And of course, I'm joking when I say that. It's the carbonation that I think is so bad. It doesn't matter if it's Sprite, it doesn't matter if it's Mellow Yellow or Mountain Dew or Dr. Pepper or Coke or Pepsi or whatever it is, like that acid is not good for you if you have fibromyalgia. And you don't want it in your system. You don't want to take acid and put acid in a stomach that has acid in it, because the body tries to balance it out. And how does it do that? It has to alkalinize it by pulling minerals from where? From the muscles and from the joints. So don't do that to yourself. It's just creating a spiral that's just going down and down and down. Okay, another question. Is diflucan toxic? So diflucan is typically used for yeast and mold and stuff like that. And the problem with yeast and mold is that tissue is similar to liver tissue. And so a lot of people, they go on a yeast diet, or they get hit too much with antibiotics, they get yeast overgrowth, then they get diflucan as a response to that. And the answer is, look, I'm not opposed to antibiotics or antimicrobials or antifungals. But here's the reality, is if your immune system was working right, you're not going to have a yeast overgrowth, you're not going to have a urinary tract infection, you're not going to have chronic sinus problems, you're not going to have Lyme disease, you're not, so these things are so important to recognize, that if you help the immune system to be healthy, then you win. It's not so much the bug problem, it's a people problem. So let's work on getting your immune system healthy. And there's so many neat things to do it: getting good food, good water, good sleep, creating a sleeping sanctuary. I think this is really important to go over, because if you can't sleep, you can't heal. So in my book, The Hidden Secrets of Curing Your Chronic Disease, well, you can get that, by the way, at drwest.info, is that it will help you to be healthy if you're sleeping better. And my friend Terry was asking me today, well, like I'm retired, I don't really need to get up and do different things. Like I go to bed when I'm tired, I get up when it's time to get up, and I don't feel very good. Look, if you saw Lily's story from about 2 or 3 weeks ago, where she was literally non-functional, and how she got her life back and how she got her health back, is she just put rules inside the system. Go to bed at the same time, get up at the same time, eat consistently. Okay, Cupcake Paper also asks how to remove PFAS from the body, so toxins from the body. I think it's really important to have a good lymph system, which is potassium and hydrochloric acid. That changes the ion structure inside of the lymph nodes. You can do that orally, you can do that with IVs. Now with potassium, this is what Dr. Kevorkian used to kill people in assisted suicides and some other things. So you want to know what your potassium levels are. I don't think it's a danger if you're getting it from avocados and bananas in your diet. But to supplement too much with potassium without knowing your potassium levels, I don't think is smart. But if you combine potassium with a digestive enzyme, hydrochloric acid, there's a study in 3 years of hydrochloric acid therapy. This is one of the secret things that you do with chronic infection, is you get the lymph going. And if people are out there listening that have lymphedema, hey, what we should do is we should put you on a program for that, a carefully monitored program, because it'll get your lymph nodes to work better in my clinical experience. How to remove Marcons from the nose. Can you get yeast and bladder infections that cause urinary tract infections? Yes, you absolutely can. And it's because your immune system isn't healthy. Get your immune system healthy. So one of the other things that we're going to talk about, this is one of my favorite rancher stories from not feeling good to health. So we're going to cue that up. We're going to show that. Remember, this is about fibromyalgia, and all of the information that we've been talking about is in a report, the Fibromyalgia Report by Dr. West and the West Clinic team. You can get it at #FMS. and it's a way to help people restore normal function. Now, fibromyalgia is a complex, multifactorial condition where the muscle fibers hurt all over. Is it ligamentous instability? Is it infection? Is it emotions that cause physical problems? Is it physical problems that are causing emotional disconnect? And is that playing on each other and making this catch-22 system? And then also, where are the hormones in this whole balancing process? And was it one of the 3 T's? Was it toxins? Was it trauma? Was it thoughts? And so all of that's important to evaluate. But that being said, there are some amazing treatments that you can do for people that have fibromyalgia. Vitamins, minerals, essential fatty acids, good thoughts, good emotions, getting stress out of your system, allowing yourself to basically be in Zen or connect, prayer, meditation, journaling, breathing, all of those things are so important. And then also this helps so many people when we bring it to their attention. Let's get something in your body that gets rid of toxins and chemicals, and that's water. And be really careful of acid that you're putting in your system. Tomato juice, orange juice, apple juice, and soda pop, or carbonation particularly. Be careful with that. Get the minerals in, get the vitamins in. Now, let's cue up this. I'm so excited. I think it's 1:20. And if you want information, please hashtag FMS. And then the other thing is, I'd love to know where people are when they're watching this. So give me a shout out from different parts of the country and check this out. Okay, sorry about that. I don't know what happened. We had a video loaded up, and it doesn't matter. You're going to see this. We have a mini course that we're developing right now, a free webinar on fibromyalgia. It's in production right now. We're talking about how to make muscles stop hurting without using prescriptions, without having to do antidepressants and happy pills and stuff like that. Just the natural treatments, the best treatments that you haven't heard about, so that you can get your life back. So we're ready to wrap up on Dr. J Live. It's the 3rd of September. We're so excited. Every Thursday at 5 o'clock we're doing these. We're getting ready to unleash our whole arthritis program. And unleash means we have a webinar system. We have a free ebook that talks about the arthritis program. There's an app that's coming out where you can be in the store. You can look at different foods and recipes. There's a knowledge base. There's different videos and stuff that you can see. Like, it's all coming. And it's exciting. Anyway, this is Dr. Jason West, Thursday Night Live. I'll see you guys next week. We're going to talk about a different type of arthritis called autoimmune arthritis. We'll see you guys next week.